You like it here.
Huh?
You like this doctor's office, I'm guessing. Okay, please state your name.
My name is Weedmeyer.
Okay. What brought you to Dr. Power's office?
I have macular degeneration,
Okay.
and I was referred to him by a doctor I was going to, a regular ophthalmologist, I guess he would be. And I started going to Dr. Powers right after they found out that the bleeding was there, and he's helped me tremendously. I started coming to him about 6 years ago. I've been having shots in both eyes. At first I only had macular in my right eye, and then it went to my left. And I'm very thankful to be seeing as well as I am today because of Dr. Powers.
Okay. Here. Were you seeing another, sorry, you answered some of the questions already, but you were seeing another doctor before you saw
Yes,
this
and
doctor?
then he referred me to Dr. Powers
Okay,
because of the macular.
okay. How many years have you been coming to see Dr. Powers?
It's about 6 years.
6 years, okay.
Mhm.
And what has Dr. Powers done for you? You've already said some of it, but...
The doctor has improved my eyesight. My eyesight would have been much worse if I hadn't started coming to Dr. Powers, as I said. And the bleeding started in my other eye after I started coming to him, so he is now treating both eyes.
Okay. Is there anything else you would like to add about Dr. Powers or his staff?
Just that if anyone needs to see about their macular, if they're not happy with their doctor at this time, to check on Dr. Powers. He's a wonderful doctor. He's not only a very kind doctor, he's a very knowledgeable doctor. And I thank him so much for what he's done for me.
That was great. Okay. Okay, can you please state your name? What's your name?
Ruth Duncan.
Okay. What brought you to see Dr. Powers? Oh, why did you come to see Dr.
I was having trouble with my vision and had been going to the doctor that he had been associated with before. And then when he left and started his own business, I went with him. The best thing I ever did in my life. 4 years ago, I was legally blind in my left eye. And now I read and I crochet and I thread my sewing machine needle without glasses.
Oh, wow. So, you were seeing another doctor before, or, well...
Well, I had gone in because I had trouble with my vision and I thought I needed new glasses. And that's when they discovered that I had macular degeneration.
Okay. How many years have you been seeing Dr. Powers?
I've been going to Dr. Powers now for 4 years.
4 years.
Or maybe a little over than that. I can't remember.
Over 4 years, right? What has Dr. Powers' treatment done for you?
I can see.
Okay.
It's just a miracle. I mean, I really do have... I read a book, at least 5 books a week. I love to read, and I knit and crochet, and I sew, and I do a lot of things. Without glasses, I can't believe it. At my age, I'm 89 years old, I cannot believe how lucky I am.
You look really good for your age.
Thank you. Well preserved.
I didn't think you were young. Is there anything else you'd like to add about Dr. Powers or the staff?
I love him, I love his staff. I think it's just, he's just the best thing that ever happened around here. And if I ever get through with these treatments, I'll come back just to say hi because I feel at home here.
So they're really friendly. And...
Oh, couldn't be nicer. Every one of them.
Okay, awesome. That was great. Thank you. What is your name?
I'll cover everything, okay?
Okay.
Let me go from there.
Okay.
You ready?
Yeah, I'm ready.
Are we rolling?
We're rolling.
Okay, all right. All right. How many of us have seen the commercial on television where a man comes up and says about his physician, oh, he's so nice, and then the lady follows up with, and his fees are reasonable, And with a little wink in her voice, she says, and he's good looking too. And then there's a Yellow Page ad where the doctor claims that his staff makes everyone feel like a friend rather than a patient. That's not what it's about. Here's what it's about, in my experience. It's about intellect. Dr. Powers was magna cum laude, darn it.
If you want to say Dr. Powers was magna cum, what is it, lewd or
Laude.
You can say that again.
Magna cum laude. Dr. Powers in the intellect department was magna cum laude. And then there's training. He's a retinal specialist. If you're diabetic, you've got propensity for damage to the retina. If you're aged over 60, you have the potential, I think 1 in 5 have a potential for AMD, age-related macular degeneration. So many of us need a retinal specialist, and he's had the experience. He's been in this business for 10 years practicing, same practice. And lastly, he's got probably $1 million worth of technology. Retinal examination requires technology. I was with an ophthalmologist as a patient, and he suspected something was going on in the back of the eye, in the retina. And but he couldn't tell for sure because he didn't have the high technology equipment. But nobly, he referred me to Dr. Powers because he suspected something was going on. It turned out I had wet macular degeneration, age-related AMD, in one eye only. The other eye was normal. But there's a tendency for the problem to migrate from one side to the other. At any rate, I was so happy to get the diagnosis and feel that he could do something about it. Now, with macular degeneration, it's not something that can be easily reversed, but it can be stopped, and that's important. So, my name is Lars Linden, and I've been coming to him for 3 years. I'm so pleased with his experience and his wisdom and the fashion in which he's cared for my AMD, and it really has not gotten any worse, which is pretty much the best you can hope for. And one eye has had no tendency for the AMD at all yet. So that's what it's all about, and these other factors of being kind and so on, sure, he has that, and his staff works fine with making everybody feel at home. But if I wanted to have friends, I'd go on Facebook. So it's not friends, it's not kindness. Rates, fees, fee structure is taken pretty much care of by the government. So we don't have to worry about those things. All we care about is intellect, training, experience, and technology. Thank you.
That was. If you could please state your name. Oh, state your name.
Ben Pitzer.
Pitzer, okay. What brought you to Dr. Powers' office?
I was seeing another doctor annually. So about 5 years ago, I woke up one morning and this right eye, it was like somebody pulled a shade down over it. So it turned out to be a very severe detached retina. So I called my regular doctor, and it so happened that was one of the days, one of the 2 days a week that Dr. Powers worked out of that office. So I got to meet him then, and he saved my eye.
Oh, awesome. So you were seeing another doctor, but...
Yes, just for the annual checkup, Dr. Hobart, if that's okay to mention a name. I don't see him anymore.
Okay, so yeah, okay, you already answered what your eye condition was. How many years have you been coming to see Dr. Powers?
I meant to look at I guess about 5, I'm guessing now. Maybe not hardly be that long.
Okay, that's okay. Okay, what kind of treatments did Dr. Powers do for
Well,
you?
originally when I met him, and he died, he looked at my eye good, and I told him what was going on, and he says, "Ben, you have a detached retina." So what he started doing, he put a gas bubble in there inside of my eyeball. I could see through the bubble, and he said that will eventually go down, and he was pushing that retina back in the place back there. Then he was doing a lot of laser work. So he wanted to see me every day for about 2 weeks, so I was going to his office down in Clearwater because he was only up here 2 days a week.
Gotcha.
Now I also, long before I met him, I have in my left eye, I don't have good vision, just a peripheral. Layman's terms, I have a hole in the macro. He has kept it from getting any worse, so I still have my peripheral vision.
Okay. And what, you mentioned your outcome, but what was the outcome of your treatment?
Positive, very good. I'm back to normal now. Of course, I need to wear glasses, but I did long before then. But nothing bothers me anymore. Hardly ever see a floater, but I come to see him regular. And he keeps a close check. And I can't praise him enough for what he's done.
Okay, is there anything else you would like to add?
Well, yeah, because during that initial period, he got called out of town on an emergency. So he gave me his personal cell phone number. And he said, "If you need help, call me, and I'll tell you what to do."
So he really cares about his
He
patients.
saved my eye, my sight. I'm sorry,
It's an emotional thing.
but he's quite a doctor. I can't praise him enough.
That was great. That was perfect.
I don't know what that means, no problem.
Oh,
It's,
I don't know, everyone says it. Okay, can you say your name again?
my name is Arthur W. Oh, I can start.
It's okay.
Start again. My name is Art Stevens.
Okay. What brought you to Dr. Powers' office?
I had been refused treatment by my doctor for many years. I've been treated for macular degeneration for 20 years now. And he wouldn't take my insurance any longer. So I went to another doctor who was fine, but he didn't really treat the macular degeneration. And a friend in church said to me, "I really ought to come to Dr. Powers." And I was reluctant to do that because I thought that everything was being done that could be done. And I finally came to see Dr. Powers and found out that that day I had blood in both of my eyes. And he started treatment that very day for me. And he has not only stopped it, but he has actually helped me to have some vision restored.
Okay, that's awesome. How many years have you been coming to see Dr. Powers?
It's about 1.5 years.
Okay. Do you see him regularly? Like,
He does one injection in my left eye with Lucentis once a month, and he's now treating my right eye, which is is completely missing in the center, but peripheral vision. And so now he's doing both eyes, so I've had about 16 treatments.
okay. And the outcome of your treatment has been positive?
I didn't understand.
Oh, I'm sorry. I'm kind of repeating kind of like what you've said before, but what has been the outcome of your treatment?
Well, I mentioned the outcome is that I'm much better. I'm able to see better, and I'm functioning. I don't drive. I gave up driving some years ago, long before I came to him. But I am very active. I'm in very good health, and this has helped me to be able to travel, to function in my church. I've just gone back to singing back in the choir again, and it's definitely improved, although the macular degeneration is not supposed to be to improve, but it certainly, he restored because it was in very bad shape.
Okay, is there anything else you would like to add about Dr. Powers and his death?
I have referred numerous friends here, and I've had my daughter here who comes to visit me from Pennsylvania, and she is very excited and grateful for the treatment I've gotten here. I have nothing but the best to say for Dr. Powers and his entire staff.
Great, that was perfect.